Hello, today we're going to be doing a spay surgery on a cat named Rosie. Rosie is a 6-month-old domestic shorthair. So the first thing that I do is pull out some of my equipment that my doctor is going to need. So a gown, gloves, his surgical scrub, a towel to dry his hands off with after he's done scrubbing in. And I'll actually demonstrate that a little bit more further when we get to that point. So checking my surgical suite, making sure that my table is set up appropriately with the monitoring, the lights. I'm coming over to make sure that the table is turned on so it's going to be able to warm up and keep the patient warm to prevent hypothermia. I'm gathering my instruments. So we have a spay pack and a drape with a blade. So the patient's already being induced over on the dirty surgery area while I set up. So I'm meeting with my technician, Brenda, who's going to be intubating while I help assist her. I had trachea tubes, eye lubrication, and clipper blades laying out for Brenda to use for this procedure. I'm lubing the eyes here once the cat is out under anesthesia. So with my clean clipper blade, I'm going to shave her belly. And unfortunately, those clippers were not working very well, just because I think they've been dropped too many times. So we need to retire those. And I grabbed the better ones. So we're shaving, making sure that we don't make any abrasions or actually cut the patient. We always clip the nails before we go into surgery. We don't want to clip the nails while we're in the OR. We don't want to get the nails and the hair everywhere. So we try and do everything in the patient prep area. Another thing that we do prior to spays is express the bladder. On this cat, I was having a little bit of difficulty just because the bladder was very small. So Brenda was having to check behind me. Not much came out. All right, now that the patient is prepped, we're going to move her to the OR for her spay surgery. Since Brenda's doing anesthesia, she's going to be setting up the anesthetic machine and monitoring the patient, and I'm just helping with tying the patient up to the table, getting her prepped for surgery, of course monitoring her as well in different aspects. So when you tie her up to the table, you want to make sure that you don't tie too tightly. You don't want to cut the circulation off to her legs. Another attempt to keep the patient warm is to put a blanket over top of her extremities and her chest. So I'm using chlorhexidine scrub with rotating alcohol to clean her up. In the first couple of swipes, I just did that to get most of the hair or any residual dirt off of there. So I wasn't using the actual technique at that point. So one thing that we completely did not notice until after the patient was asleep, this was a wild cat when it came in, so we ended up just poking her while she was in the cage. We weren't able to handle her prior to doing anything. So she didn't have an IV catheter in. So while I'm scrubbing, Brenda and Sherry were trying to get an IV catheter in so we can get some fluids going into her. However, they were unsuccessful trying to get it in because of the positioning. I believe she had dexdomitor, so her heart rate was really low and her blood pressure was really low. So I just focused on what I was doing while they attempted to do that. Because of the situation, I do demonstrate how to set up the fluids, but we ended up giving sub-Q fluids afterwards. And sometimes that's necessary with these crazy cats. So after I scrub, I did my final spray. All right, so here's where I set up the fluids or demonstrate how to do that. She's a very small cat. I believe she was about 5 pounds. So because of the confusion with the catheter, I wasn't able to gown in my doctor, but I will show you later on how to do that. But here I'm just opening the pack using the corners to pull out, trying my best not to touch anything I shouldn't. trying to figure out what side of the table the doctor's going to stand on, and I move the table over. So now that he has his pack open, I can go ahead and drop his blade. And usually when you drop the blade, you want to tell the doctor the blade is on the pack. That way they don't surprise themselves and get stabbed. Now that the pack is open, it's important not to lean over it, cough on it, have too many people walk by. You want to keep that pack as sterile as possible. Well, you want to keep it sterile the whole time. And turn the lights on. And get them positioned appropriately for the doctor. And this light, I completely forgot, it does not stay up very well. It's a very old light. We don't use this surgery table very often, so a lot of this stuff was forgotten. So we just use a different surgery light. Finally, my doctor requested some suture. So walking past the pack that's open without touching it, I'm going to grab the size that he wants and the type. And then I'll gently open it and put it on the pack without touching the actual suture and without touching the pack with my body, my limbs, or breathing on it. Now we'll speed up a little bit, and this is just me standing by, waiting for him to give direction, checking to make sure everything is in place, the patient's stable, Brenda's not having any difficulties or needs anything. All right, now that the doctor walks away, that means I'm able to start touching things. So I'm going to go ahead and throw away the disposable drape. I want to try and clean some of the surgical scrub off of her with some peroxide gently. All right, here's where I'm going to be gowning in my doctor. So because I didn't get footage of this before, I'm actually just doing kind of like a mock video, and I rewrapped this gown. So it is sterile, except the middle pack was not wrapped very tightly and it came open. That should not happen. I opened up his gown, or sorry, his gloves. So he's already scrubbed in, dried off with his hand towel. He's used his Chlorohex scrub that I had setting out for him previously. He's putting his gown on, and once it's on, I'm trying to stay out of his way so he doesn't hit me with it. Once it's on, I'm going to turn around and clasp the top. This is a very old gown. It needs to be thrown out. So it's not really sticking. And if this ever happens, you either throw it away and get another one, or you clamp it with a hemostat. In this case, I had a piece of tape, so I just used that. And that is me gowning in my doctor. So he's ready to go into the OR. Here's a video that I actually took in the middle of the procedure, setting up the patient's cage for where she's going to be recovering. So that little mat there is actually a warming device. It warms with the patient's body heat. It doesn't get too hot. They're actually really handy, and we like them for cats. But I figured since she's going to be recovering, she needs something on the entire cage and something for on top of her. This is fun. All right, now that the patient is done with surgery, I'm going to go ahead and take her first over to check her vitals. Actually, I'm sorry. Grab the thermometer so I can take her into her cage and take her vitals. She still has her endotracheal tube in and it's still inflated. Check her incision, make sure that it looks good. There's no bleeding, no bruising. Cover her up to keep her warm. So I'm taking her temperature and I can feel her pulse while I'm back there on her femoral. She was actually nice and warm. I want to keep her sternal for when she wakes up. So I'm gently just trying to stimulate her a little bit, rubbing her face, talking to her. All right, and then Brenda's going to take over where I start cleaning, just because we not waste any time right now. So there's stuff everywhere. There's cords on the floor. The monitor's still on. Basically, you just have to get the monitors under control and get the cords wrapped up. Alright, I'm spraying the table down, letting it have some contact time. Turning the lights off. After this, I'll come in and sweep, and I'll use a mop with new water. Don't use dirty water in your OR. We actually have a mop bucket that's designated to the surgical suite. We don't use it anywhere else. We had one more surgery to do, so I did not do it just yet. Alright, here I am. I'm going to scrub the instruments. Okay, we're scrubbing all the instruments and making sure we put them in the ultrasonic cleanser. Once it sits in the ultrasonic cleanser for 15 or 20 minutes, we pour it out, put lubrication on it, and pack it up, throw it in the autoclave. I had a lot of packs to wrap that night, so I did it separately from this video. Ultrasonic cleanser. And now we wait. I have things set up to wrap the packs here. Just putting gauze in, making sure I have the indicator strip in.